Ladies and gentlemen, good morning. I am speaking to you from India, and our faculty will be speaking to you from the UAE. This is our third webinar in the 2024 series. Our 2024 DiaBeat webinar series. Today is Friday, the 30th August, and we have an interesting subject. And I'll tell you why. The interesting subject is the role of carbohydrate diet in diabetes care. Now, I have recently read about the best diets for diabetes in 2024, and this was decided by Forbes Healthcare. They picked up some of the leading dietitians in the world and asked them to comment on what would be the best diet for carbohydrate for diabetes, and 4 diets in particular were picked up. One is the Mediterranean diet. The second is the DASH diet. The third is Ornish's diet. And the fourth, of course, is the MIND diet. Now, some amazing similarities. The Mediterranean diet is a broad, balanced diet which has fruit, vegetables, whole grain, legumes, fish oil, fish and olive oil. Now, that is very similar to the DASH diet, which has almost the same things. And the DASH diet, as you know, is the dietary approach to stop hypertension. But the one difference being that in this instance, they moderate sodium. Ornish's diet is different. He, by and large, does not advocate oil, and he does not advocate any form of meat protein. The MIND diet is a combination of all of these things. It's a combination of most of these diets. The amazing connection that I see between all of these diets is that they all propagate low carbohydrate, and they advise you to keep away from simple sugars. And that, ladies and gentlemen, is the brilliance of our speaker today. She talks about exactly the same thing. You put together the best diets in the world and you come to a single comfortable conclusion, and that is carbohydrate. But ladies and gentlemen, I will leave our brilliant young speaker to talk about this, and that is Ruba. Now, Ruba is the head of Department of Dietetics in our own RAC hospital. She is a professional health coach, and here is the difference. She is a health coach in addition to managing therapeutic diets, cardiovascular diets, post-surgery diets, and endocrine diets, besides, of course, weight loss diets. She has a beautiful amalgam of both ends of the spectrum, wellness and illness. Her range spreads from neonatal to pediatric to adult and to individuals like me who are geriatric. And her credentials are clearly seen from her professional associations, the American Academy of Nutrition, the Arab Nutrition Association, the UAE Nutrition Association, ESPEN, ASPEN, and so many others. Ladies and gentlemen, I will not take your time. I will leave you in the hands of this brilliant young dietitian.
Thank you so much, Doctor, for the lovely introduction. So let me share my slides. Okay, So today, our topic in relation of diabetes management is very important, and it's very also interesting at the same time. How do we explain this diet and its impact on blood sugar in general? So briefly, I will take you again over the characteristic and the complication with the goals of the treatments of diabetes. Then we will go through the diet therapy in terms of managing our blood sugar and how to plate it, how to portion it, how to transit that into our daily intake of food according to the macro and the micronutrients. And then in the end, I will talk about the role of carbohydrates on controlling the blood sugar. And as we know, diabetes, it refers to a group of disorders, which is characterized by either elevated blood sugar concentration or disordered insulin metabolism itself, where the body is unable to secrete sufficient insulin, use of insulin effectively or both. And insulin, usually it's a hormone released by our pancreas to control glucose. Usually, insulin secretion increases after the ingestions of food, and it enables the muscles and the adipose tissue or cells to take up the newly absorbed glucose from the blood. And it also occurs between meals in smaller amounts. So this actually affects by our intake of food. And if it is uncontrolled, it will lead to complications. It can affect our heart, it can affect our blood pressure, cholesterol profile, it can lead to even some dental problems, loss of vision sometimes, additionally nerve damage, and if it is uncontrolled, it can also lead to damage of our kidneys. But the good news is there's a fewer complication when the blood sugar is kept as close to normal as possible. When we only combine the healthy eating with our regular physical activity, and if needed, treated by medication. The goals, as usual, will be to control our blood sugar and maintain the levels as normal as possible, and maintain the healthy blood pressure with a good cholesterol profile, to also manage our weight, and all of these goals aim to prevent and reduce the risk of the complications. So explaining the body weight changes between type 1 and type 2, most likely in type 1 diabetes patients, they are less likely to be overweight. They are usually either underweight or they struggle to gain weight, and they are usually kept on into insulin therapy. But the excessive weight gain sometimes is a good sign that the blood sugar is getting normalized. And the cause of weight gain is unclear, but it may be related to the stimulation of the senses by insulin. Usually, type 1 diabetic is more common in children. So it's very important to monitor their intake on a daily basis to ensure that they are covering their needs and covering their carbohydrates as well, and align with their insulin regimen. So usually in type 2 diabetic patients, the excessive body fat worsens insulin. So there is more weight gain, and it's visible more in type 2 as we see a lot of obese and overweight patients. And they will benefit definitely from weight loss in general. As low as 5% of their weight loss, it will improve their glycemic control overall, their cholesterol levels, their blood pressure as well. And positive effects appear to be related to the restriction of their caloric intake. Not all diabetic patients are obese and overweight. Older adults are often underweight as well. So it is always good to monitor their food intake and the impact of their diet. Going further, talking about the diet therapy itself, the role of the carbohydrates in the diet of the people living in diabetes, is an area of much of the debate. As we know, a lot of studies has come to compare the concentration or the percentage of the carbohydrate with different diet aspects. So this relates to both the type and the quantity of the carbohydrate consumed, with lower carbohydrate diets increasing in popularity. However, it's also important to take it as a whole diet approach, not just a term of a single nutrient as it is. There is no obligate requirements for dietary carbohydrate intake. International recommendations suggest that around 50% of the total energy should come from carbohydrates, along with the protein and the fat in general that comes to the total intake. However, carbohydrate quality is very important in terms of the glycemic index, and in the fiber may have other health benefits, such as improving the digestion and as well and slower the absorption of sugar from the food. There is no universal recommendation for the total amount of carbohydrates. It's highly individualized, and it should be based on personal preferences, individual glycemic response, and other health targets that can be set by the doctor or the dietitian for the patient. So how we go further? How do we plan our diet? We usually use or rely on different meal plan strategies that focus. Some will focus on controlling the carb intake and portion size. Others may make sure that you are eating in a regular pattern with regular intervals, spacing also carbohydrate intake and evenly throughout the day, another strategy. While those who are with injections, especially type 1 on insulin, it's very important to coordinate their intake with the meals and adjust the doses accordingly. To make it easier for diabetic patients, it's very important to plan it according to the diabetic plate method, whereas quarter of the plate should be from starchy or whole vegetables. So it's not only about the quantity, also about the type of the carbohydrates, and to make sure there is around 30% of the meal component from the lean protein. The rest should be non-starchy vegetables or salads to ensure there is enough fiber intake. Planning the diabetic plate also should emphasize on a healthier cooking methods, and planning ahead will help or guide the patient or guide the diabetic patient to make sure that he is choosing or doing a healthy shopping, smart shopping, that he is also focusing on the nutrient-dense meals, and it will make him plot his daily intake from calories and from sugar itself. As a dietitian, we usually plan the plate or plan the diet for a diabetic patient relying into two simple methods. One is the carbohydrate counting, which is simpler and more flexible than the other menu approaches. It focuses on daily carbohydrate allowance based on the individual. We usually plan according to the needs of each individual from his total caloric intake, and make sure that majority of it is from the complex carb. The other method would be the exchange list, which is more complex, and foods are assorted according to the proportions of the carbohydrates, proteins, and fat, and more structured. It has more structured dietary plans. A healthy plate, as I mentioned, should have a balanced proportions between the carbohydrates, fats, and protein, emphasizing on the carbohydrates. As more grams of carbohydrates, the glycemic response will be higher after meals. So the quantity and the type is very important, and it should be consistent at meal times and snacks to help reduce the fluctuation of the blood sugar between the meals. Following a low-carb diet, especially when it comes to very low, which is around 130 or less grams per day, is not advisable if it is not monitored closely by a health professional. As we know, there is different sources of carbohydrates as a diabetic patient or a person who's aiming to control a better control of blood sugar. The type here is very important as we see the complex carbs, for example, if it is legumes or if it is whole wheat, buckwheat, it has a better glucose readings after consumption. Rather than the simple sugar like pastries or processed food itself. And the glycemic effect is actually influenced by, as I said, the type of carbohydrates and how the food is processed or prepared. Sometimes the way you are preparing the food matters more than the type of the carbohydrate itself. And if the food content, if it's low or high in fiber, if there is any other food types combined with the meal itself, and according to the person or the individual intolerance himself to blood sugar. So what is the glycemic index? It's actually a ranking for a carbohydrate foods we use based on the actual effect, how likely they cause an increase or a spike of blood sugar. It may be helpful when it comes to making the food choices. So we focus more on, it will lead to focusing on the higher fiber and whole grain products rather than having the higher ranges of the food. So I'm sharing here just a sample of the ranking of different food. As you can see, the lower in glycemic index could be the ones that are not actually having a lot of fiber intake compared to the higher in glycemic index to the simple or processed sugar. So it's very important to be aware of the glycemic load and the glycemic index of food, because sometimes you restrict the total intake of carbohydrates, but you don't pay attention to the effect of the food or the type of food itself on your blood sugar. Fiber recommendations remains the same for all the general population, which is 25 grams per day for women and up to 35 to 38 grams per day for men. It plays a very important role in regulating blood sugar, and people with diabetes, they are more encouraged to include fiber-rich food. An example of that, like the lentils, as I said, fortified cereal, some kind of fruits, especially with the skin attack, and a lot of vegetables. And still some research suggests that the fiber intake of 50 grams or more per day, which is almost double the recommended amount, have actually may improve the glycemic control, but still not consistent. Coming to that second type of carbohydrates, which are the simple sugar, usually we don't restrict it. We calculate it as a type of the total intake of carbohydrate for the person, but as an advisable and more better effect, we tend to advise the patient to avoid it, like avoid the juice, try to have the fruit as it is, because it will be considered as sugar, and it has higher glycemic index and higher impact on the blood sugar, but it is still the choice and depends on the individual themselves. And although the fructose also has a minimal glycemic effect, it is used as an added sweetener, and it may adversely affect the blood lipid levels, but not referring to the naturally occurring fructose. Another method is to also use artificial sweeteners like aspartame, but in place of sugar. But it's always good to be getting used to the complex carbs and avoid any kind of simple sugar. Apart from carbohydrates, let's highlight the importance of consumption of fat. As we know, the diabetic patients, they are at risk for cardiovascular disease, and they might also have an elevated lipid profile. So their fat consumption should be monitored. Saturated fat should not be exceeding 7% of their total intake, whereas focusing more on MUFA and PUFA, which is the unsaturated fats, that relying in healthy fat choices, but it should be also not contributing to more than 25% of their total energy intake. Highlighting that the cholesterol intake from the total fat per day should not exceed 200 milligram, and keeping an eye on the trans fat intake, where they should avoid as much as possible. When I talk about protein, which is a very important component of the diet itself, missing this macronutrient may lead in fluctuation of blood sugar. And as well, if the body is not used to, let's say, if the person is not exercising and started exercising with a deficient protein, they may end up in muscle loss rather than the fat loss itself. As we know, the total body weight is composed from fat and muscles and other fluids. So it's very important to make sure that the person or individual is having enough of protein, and it should not be less than 15 or 20% of his total energy intake, with main focus on the lean protein, as it's a lot of studies suggested that higher protein intake may improve glycemic control and increase satiety for a long-term effect as known. In addition, higher protein intake discouraged because it may be detrimental to kidney function. As you know, as an outcome of the blood sugar, sometimes the higher protein intake may lead to, it can damage the kidney function. So it's very important to keep an eye on that. So coming to the other component that is very important and crucial, the other micronutrients, where it's actually the same as the healthy population, that it is not recommended to supplement it, and unless if there is any nutrient deficiency is developed. And other studies suggested that chromium supplementation can actually improve the glycemic control in person with type 2 diabetes, but the result is actually inconsistent. So highlighting our topic today, talking about the importance and explaining the low carbohydrate diets and effect. As we know, it's a strategy, one of the strategies to manage type 2 diabetes. Low carbohydrate diets have been having long interest in the scientific community and in the general public, but the topic remains very highly controversial. To explain it, what is a low carbohydrate diet? It is limiting the carbohydrates, such as the found in the starchy vegetables, not only the grains, fruits, and emphasizing on a higher protein and fat intake. A normal carbohydrate intake is actually around 45 to 65% of the total caloric intake, but moderate to low carbohydrate intake is going beyond 44%, as low as 10%, which is around 20 to 50 grams per day. And this is not applicable to all the cases. Going into a low carbohydrate diet should be pre-evaluated by a profession, and it should be based on the individual needs and targets. The purpose of the low carbohydrate diets, of course, to lose weight, as we are restricting the sugar, providing more health benefits, and a lot of studies are being done and conducted on this, and to reduce the disease risk. As an outcome, some reduced carbohydrate diet diseases decrease diabetic risk, but others may actually raise it. So the American Heart Association has found that if the diet is mainly low in carbohydrate, but focusing on animal-based proteins, there was no improve in the blood sugar. Actually, there was a higher or increase in the blood sugar in these patients. Apart from, on other hand, the other people who were consuming lower carbohydrate diets, but with focusing on plant-based protein, the study has showed an improve in the blood sugar at that time. So it's very important to consider the type of the carbohydrate that we consume and plan it ahead. Make sure that it's consistent with all meals, similar proportions, and to make sure that there is no long period of time skipping the food, especially if you're a diabetic patient. This will result in fluctuation in blood sugar. Low to normal, or let's say low to moderate carbohydrate sample of a diet plan would look like this, contributing or focusing on the complex carbs on each meal, making sure there is sufficient or enough protein, and omitting trans fat and omitting fat, let's say oils as much as possible, but not skipping any meal will actually result in a better or improved in the blood sugar. Thank you. And I will be happy to receive all the questions.
The thank you is from us to you, Ruba. The thank you is really from us to you. And I think I could say more precisely, the thanks is from me to you specifically. And the reason for that is I'm going to leave Dr. Wilku to ask the questions, but I was quite distressed to see that the highest glycemic index that you pointed out was from rice in its various forms. And rice,
Yes.
as you know, is a staple of the Indian diet, and unfortunately, I am a victim of that. Nevertheless, I notice that you have mentioned 150 grams of carbohydrate, but more specifically 12 tablespoons of rice. And I am going to be your disciplined student. I am going to make sure that I do not have more than 12 tablespoons of rice. And I will let you know, ma'am, what happens with that. But I must not be selfish, and I must not take advantage by occupying the screen. I will leave the screen to Dr. Wilku, who is so balanced in his judgment and allows so many individuals' questions to be answered. Dr. Wilku, sir, the stage is yours.
Thank you, Professor. Thank you, Professor. Well, thank you. Wonderful session. It's a complete new essence of what we saw today. So, likewise, every time people have many queries and they are going through internet and they are getting a lot of information, most of them are misguided because everyone that's not that authentic to be used because they are not well researched. So every time the similar questions come across in a different format. Like as soon as you started, within 10 or 15 minutes, 2 or 3 questions popped up. Jinsi has asked, it's a good question. I'm interested to see all these type of questions. Is protein diet safe for my mother? And she is diabetic and also has a uric acid. No controversial thing.
So, see, usually, and what happens is if the blood sugar is not controlled for a prolonged time, there will be a slight effect on the kidneys. A nephropathy can be developed. Uric acid itself, it can be related to either a kidney problem or it could be related to other bones or joint problem. usually patients with the higher or elevated uric acid, if there is inflammation, they have to be on a low purine diet. Low purine diet doesn't restrict the protein, but it restricts the type of protein. So which means that certain food that are higher in uric and purine, that should be avoided. Protein itself, as I said, is an essential macronutrient that our body needs. Without relying on protein, especially if she's an elderly, or above, let's say 50, we are prone to lose our muscles anyway with the less physical activity, maybe diminished appetite, the portions are less. So eventually she will be taking less of her caloric intake and requirements from each macronutrients. So if that is the case, then she will have to just pay attention to the amount that she's taking, and as follow the same food that are lower in uric acid. And definitely she has to have a lot
Yeah,
of
true.
fluids.
That's the
So
reason many of
yeah.
and that's the reason many of the times people are confused whether protein is only sourced by fat or any products. So like Anu has, how can a vegetarian get protein? Many people are confused whether the vegetarian food has have a protein or not. So, Ms. Ruba,
It's a good question
how
because
vegetarian can
it's a good question. Usually we are saying, we are highlighting on the animal-based protein, but we also emphasize that there is another type of protein, another side, which is the plant-based. The only difference is the way you are taking it, the combination itself. It's a challenging, it's let's say not difficult, more challenging maybe for diabetic patient, because the plant-based sources of protein are actually high in carbohydrates. But if it is restricted or giving in a proper time, proper amount, proper combination, then they will get. Majority of the vegetarians, they are depending from their food on pulses and legumes, which is the main source of protein from non-animal based products. So still they are getting. So if it is there on a daily basis, or if there is lacto-ovo or vegans, if they are eating eggs, if they are eating curd or dairy products, this is another source of protein. Nevertheless, not to forget, majority of the fat products like nuts also, they contribute to a smaller amount of protein. So again, it's coming to the proper planning. As per the person needs and requirement, they can still deliver their needs from the animal-based products very easily, just paying attention to the combination and the amount, so they don't exceed the carbohydrate levels or recommended levels per day they are taking.
Yeah, true. That's the reason you just mentioned about why protein is important and what are the causes and pros and cons for that. This is very interesting question. Many of the time people think drinking juice they prepare at home. Like Piyush has asked, he knows that people are aware of commercial juices. So he's making juice himself and he's not adding to it. Is it good for a diabetic patient?
This is very common because majority of the people, they fall into this mistake, thinking that if it is homemade, still it doesn't, after they didn't add sugar, it's still low in sugar. But I'll just highlight what are the type of juices. We have the commercialized, we have the non-commercialized, which is homemade. The derivative of it, again, it's fruits, okay? The fruits, it's considered simple sugar because it is still sugar, but it's higher in fructose and saccharose and all. So it still leads to a spike in blood sugar. Whether you didn't add sugar or not, the total amount relies also on how many fruit pieces did you add to conduct or yield a cup of juice. If you are going to consume an orange, it's different from than consuming an orange juice, where you are using 3 to 4 pieces, which is triple the amount. So you are adding more sugar in this way. Again, when I spoke about the glycemic index, I highlighted certain food. If you come back to my presentation, the sugar very high, very fast. So again, a diabetic patient is not advised to take a juice unless if he is having poor or very low blood sugar in certain circumstances, then we advise. Otherwise, it's not recommended for the longer use, and always we emphasize on completing or taking your So we'll take another question, Dr. Kennedy.
Dr. W, are you there, or have you
I think
gone
he
off
got,
the air? He seems to have gone off the air.
yeah, maybe some trouble.
Ruba, can you read the questions on the screen?
Yeah, I can see another question. Do you recommend
Yeah, please
smoothies
go
for
ahead, love, if you don't
non-diabetic
mind.
patients to lose weight? Okay. Someone is asking, Safa is asking about the smoothies for non-diabetic patient to lose weight, to have it instead of meals. Yes.
Okay.
Hello, Dr. Wilco. So again, it is for weight loss. I don't think it can contribute to weight loss because usually juices or smoothies are high in calories, and high calories, if you are adding it along with the diet, then it contributes to a higher caloric intake, unless if you are referring to juicing or detox diet. Carbohydrate diet, the fat and the protein will be increased. So that will not be in a favor of a diabetic patient with an elevated lipid profile, because usually if a patient with high cholesterol or a heart disease history, we tend to ask the patient to restrict the total fat intake. So when this patient follows a low carbohydrate diet, eventually he will depend more on proteins and on fat. So he will be taking more of than his needs. So this will increase in his cholesterol. It will improve the blood sugar eventually because he's reducing his carbohydrate intake, but it's not in the favor of a patient prolonged or with a history of a cardiac disease. It can be followed, as I emphasized, with precautions, with supervision, and for a certain period of time, not for a prolonged time. Another way, doctor, is also for the, I'm just explaining for, yes, another way is to limit the sugar itself rather than just going into a very low carbohydrate diet. So they will still have a low carbohydrate, which is still within the ranges of low to moderate, but focusing only on the complex carbohydrate, which we have seen actually greater results, and a lot of studies are supporting this fact.
Yeah. And
so I'll take another question.
Yeah, another interesting question. People are confused whether honey, dates, these are good for diabetic patients. Like Zobia has asked, for a diabetic patient, is it good to use honey, milk, or tea daily? Many people are confused about honey and dates.
Yes, Coming to honey, whether it's very natural or not commercialized, it's the same concept as the juice. It is considered high in glycemic index. So what happened is the spike will be there and then the drop will be there. This complete fluctuation in the blood sugar for a diabetic patient will not be in a favor for control of blood sugar. This will disturb the mechanism of controlling blood sugar and keeping it as in a moderate rate for a longer part of time. In sake of the health benefits, yes, it is healthy. Yes, it is a natural bacteria. It can improve immunity, but the more important point for a diabetic patient that they have to make, they have to keep monitoring their blood sugar. They have to understand their body. They have to understand the relation of their body to the food. What actually causes his will be what you will what effect you will give that person. So understandment on how
There are two questions which can be connected. Do you recommend intermittent fasting for weight loss for both diabetic patient and non-diabetic phase? What is the drink, healthy drink the person should?
food or fasting for certain time, it actually end up in several actions. A diabetic patient on medication is not allowed to fast because he will be on a hypoglycemic medication that may actually be dangerous for his that if he fast and take care to have a health profession, dietitian or a doctor, has been there. The improvements actually limits his food intake within a period of time. So eventually he will eat less. It will be beneficial for those who are eating late at night, or they eat a lot of food or skip their meals and eat 1 to 2 times. So when there is a gap of time, they will be more strict to it. They will have a better control on their food intake. And the other question was about the juice, taking what type of juice when they are fasting. As I mentioned, fluids highly highlighting on the water, because during fasting, usually the body will be losing a lot of water, a lot of fluids. So how to replenish it? Mainly with water. And if it is a diabetic patient who's fasting, this should be revised whether he is able to, because if the blood sugar is high, he cannot fast. If the blood sugar is very low, he cannot fast. So again, it should be reevaluated before he takes such a step.
Yeah, true. I will take one good for diabetes. Any berries are good.
What,
Bad.
what is it? Berberine?
The last one. But
Mm.
the berries. Yeah, one second. He's diabetic, and please suggest me which food should I take. Time I get sugar at 55 to 60 to make it normal. Means he becomes frequently becomes hypoglycemic.
So we need to know the cause first, doctor, because if it is due to medication, doctor has to revise the list with him and change his medication. If it is for the patient that he's not eating enough food, we need to advise him accordingly to the proper amount that he should be. 55 to 60 is considered hypoglycemic. Hypoglycemia is where the blood sugar goes very low beyond the normal, and it can lead to a lot of complications, and he can go into coma and loss of consciousness. So it is not advisable to stay on this for a long period of time. Unless if it is increased the blood sugar and then after the food it becomes very low, then there is a certain also reason behind that, that he should be on a specific controlled carbohydrate diet. Uh, if the patient goes into hypoglycemia, where it is the blood sugar goes beyond 70, the first thing that we advise is to take either half a cup of sugar with half a cup of water with 1 spoon of sugar, around 15 grams of carbohydrate, like a juice, a cup of juice, or any chocolate bar, like around 30 grams or less, to make sure that his blood sugar comes back to normal. But again, if this is if it is repetitively happening, then there is a reason behind that, where the patient has to check to fix the problem itself. If he is having constantly carbohydrate, as I mentioned, on meals and on snack, not leaving himself without food for prolonged time, then he will get a better readings for blood sugar.
Yeah, true. So I will just close with two statements. Wonderfully, you have covered all the aspects for diet. But like you said, every size doesn't fit to all. So each individual who is diabetic on medication or they are pre-diabetic, instead of searching and reading into the internet, they should consult a dietitian for a proper diet plan. That is number one. Number two, like Nadeem has said, so many people do. Once they visit the doctor, they take the medicine and they never follow up. But they actually they are lethargic. They don't want to visit the doctor again and again, and they continue the medication whatever he was told according to their convenience. It should not be
Yeah.
done. Follow with the doctor regularly on time so that the doctor can regulate your dose. If
True.
that is happening, there must be something in the background. It should be addressed well. So thank you very much, Rupa. Professor, over to you.
You know, when I when I first joined a hospital about 50 years back, uh, the role of a dietitian was very limited, if at all. It was just to make available food to the patients. Uh, Now I see, and we know that the role of a dietitian is relevant in almost every ailment. You have specific diets for cardiac, you have specific diets for hypertension, diabetes, weight loss, geriatric, and for renal, almost every area. And I can see why, listening to Ruba, I can see why there is so much abundant knowledge that comes out of this study. Dietitians are now truly an integral part of every ailment and an integral part of every patient. And for that, we have the entire fraternity to thank. And in our case, we certainly in RAC hospitals have Ruba and her team to thank. Thank you very much, Ruba, for helping us out with this webinar today. And more importantly, these webinars are seen by hundreds and hundreds of individuals through the year. Each of them express their gratitude to you. Thank you so much. Dr. Wilku, as always, thank you to you also. As always, thank you to you also. And thank you to my Arabian Wellness team. Thank you to the RAC Hospital IT team. And I must not forget to remind you all to attend our next webinar, which is on Friday, the 6th September. The topic, Yoga for Diabetes Management. And I noticed that the speaker is Miss Zarina Kennedy. Now, a good question to ask is there any connection between Zarina Kennedy and Professor Kennedy? Now, this answer, ladies and gentlemen, will come to those of you who attend the next webinar on Friday, the 6th September from 11 a.m. Thank you and good day.